Ty, let's see what's going on.
Make this make sense.
Okay.
The doctor sends my prescription to Walgreens. Walgreens confirms they got the prescription from my doctor. Then an hour later, I get a text from Walgreens saying my prescription is delayed because they need confirmation from my doctor to fill it.
So if I had to bet money on it, I 99% believe you probably have what's called a prior authorization. And usually this means that the medication that the doctor prescribed you is probably not on your insurance's formulary and is probably considered like not a preferred treatment. So what the doctor has to do is they have to fill out additional paperwork for the insurance to hopefully that the insurance will then cover the medication that they prescribe. And someone from Walgreens, please update me if I'm wrong, but when I worked at Walgreens, usually those texts would be sent out like for pretty much anything that would be holding up the prescription, including a prior authorization. And so with these prior authorizations, they can take like days to maybe even like as long as a week for it to be approved. And then what can be extremely annoying with these prior authorizations is that sometimes they may not even last for like the whole year, or you have to renew it every single year, because this is how insurance tries to save money and they try to see if like there's like a loophole to try to pull you off the medication. This is something, for example, like Cigna is doing with a lot of patients on Zepbound, because the guidelines say that you need to have like a BMI, I believe it's like 27 plus just one additional condition. But Cigna is now requiring people to have 2 conditions, which is not even like on any guidelines. But it's how they can pull a lot of people off of the medication and save themselves a lot of money from having to pay for these medications.